I think the first thing to say is I'm not sure that we have been struggling with these issues for a long time. We've been aware of them, but I'm not sure we have been struggling. Part of the point of the Commission on Social Determinants of Health that I chair is to say that we actually ought to take account of the fact that policies that are taken for other reasons have impact on the lives of everybody, and that impact on the lives shows up as health and health differentials. So a lot of the health inequalities we see in the world today are the result of policies that are taken for other reasons. So we're not actually struggling with it. I mean, to take the issue of clean water. Happily, I think most Australians, even Indigenous communities, have access to clean water. So this is not very complicated. Do you know what proportion of the world's population still can't get clean water? In the shanty towns of Nairobi, the cost of a litre of water is 8 times what I pay for a litre of water in London. These are people who are living on nothing, and they pay 8 times what I pay for a litre of water. I'm not sure we have been struggling with these issues. If we actually struggled with these issues, we would start to make some impact on them. Partly I'm generally an optimistic person, but the basis is, I would say, twofold. The first is the data, the evidence. We can see how dramatically health can change, how dramatically quickly health can change, and potentially how big the improvements can be in reduction in health inequalities. Let me give you one surprising example. If you look at black-white differences in the United States, from 1870 to 1970. Unrecognizable. We think about the big black-white differences that still exist in the US, but they're dramatically smaller than they were 100 years ago. Now, that's 100 years when we knew much less. If we look at what's been happening, let's say between 1970s and 30 years later, life expectancy in India improved by 13 years. In only 30 years. That's amazing. 13 years is just absolutely enormous. And there's one of the poorest countries of the world, and it still has 80% of its population living on $2 a day or less. And they get a 13-year improvement in only 30 years. So these things can really change really quickly. So that's the first basis of my optimism. And the second is where we see countries, governments, communities, multinational organizations taking these issues seriously, then you see dramatic changes happen. And so it gives one encouragement that there are really good examples and good evidence to show that if you take these actions, things can get better. Don't ask me for the answer, because I'm here for 3 days, so I can't give the answer. And I can't pretend it's simple, that people of goodwill have thought about it, and it's clearly not a simple question. On the other hand, I would say, given what we know in terms of evidence from around the world, that if people of goodwill, supported by government, bend their minds to this, they can really start to make a difference. It won't happen tomorrow. It won't happen in a month or a year's time. But the slogan that I've heard, which is heartwarming, closing the gap in a generation, seems to me the right way to be thinking about it. Let's start with today's young women who are going to become mothers. Let's start with the communities in which their babies are going to be born. Let's start with early child development for those children. Let's think about education and the communities in which they grow up, and say these kids can have a different life. The research agenda is absolutely vital, and can't do any of this without knowledge. So I don't think we should just go barging off and saying, well, we're good people, we're very nice, you know, we're well-meaning, so let's just do some nice things. We need to be informed by knowledge. Research is very important. One of the things that I've learnt while doing the Commission on Social Determinants of Health is that my knowledge, my approach to research and my knowledge is only one part of the spectrum of knowledge, and my approach to research is only one part of the spectrum of approach to research. So the sort of things that I've done through my academic life that get published in pucker journals is only one part of it. What the civil society organizations with which we've worked have said to us is, we know things too. We know things in a different way. And you've got to take that into account. You've got to take into account our knowledge as well. That's been a learning exercise for me, I have to say. But I'm convinced that we have to have a number of ways of learning what needs to be done.